Welcome to Louisville Presbyterian Theological Seminary and today's Greenhoe Lecture. We're so very pleased that all of you are joining with us online, as well as those who are on campus in the Wynn Center for our virtual watch party. We are extremely honored to have Dr. Duane Bidwell with us, and you'll hear more about him momentarily, but just want to say how very grateful our seminary is to you, and this memorial lecture that was established in Midland, Michigan in honor of Dr. Greenhoe is a tradition that we are proud to continue year to year. So welcome.
We are glad that you're in the space. I'm Dr. Trina Armstrong, the director of the Marriage and Family Therapy program here at Louisville Presbyterian, and also the associate professor of Marriage and Family Therapy and Pastoral Theology. And I have the honor of introducing our lecturer for this evening, Dr. Duane Bidwell. I have a little personal connection to Dr. Bidwell. We were just discussing prior to going live that we go way back to our time at Claremont School of Theology, where I received my PhD, and express some gratitude for our friendship and collegiality over the years. So my task for this time is to formally introduce him to this community. He is no stranger to this community. He has been here and has worked professionally with some of the colleagues who have come through this space. But he is currently now at the Center for Health Professions and Education. Duane is an award-winning teacher and mentor and has served as a faculty member, psychotherapist, a nonprofit director, clinical supervisor, and an accreditation specialist. He is a member of the PCUSA, the East Oklahoma Presbytery. Now, the Greenhoe Lecture draws, as Dr. Pollard says, his lecture draws from his forthcoming book on pediatric hope, which highlights the voices of 51 children living with incurable chronic illnesses. As I said, he teaches at the Center for Health Professions Education, Herbert School of Medicine, Uniform Sciences, University of Health Sciences in Bethesda, Maryland, where he oversees a collaborative program with the U.S. Department of Veterans Affairs to improve clinical education in hospitals across the country. Duane taught practical theology, spiritual care, and counseling at the Claremont School of Theology for 12 years, where he functioned as an accreditation liaison officer, co-director for the Center for Sexuality, Gender, and Religion, and he also served as senior staff clinician and supervisor at the Kleinbell Center for Pastoral Counseling and Psychotherapy. Duane has published 5 books and 40 peer-reviewed articles and chapters. His work has been featured on NPR, CNN, and the Canadian Broadcasting Corporation. His book, When One Religion Isn't Enough, The Lives of Spiritually Fluid People, was a Christian Century bestseller and Library Journal Best Book of 2018. His research is in spirituality and mental health, where he explores identity, agency, and possibility as building blocks of effective care. He works from a relational strengths-based perspective with expertise in solutions focus, narrative, and appreciative practices. He is on the boards of the Society for Buddhist Christian Studies, the Taos Institute, an international educational organization that promotes relational approaches to education, organizational development, mental health, and other issues. He's also the former editor of the Journal Pastoral Theology and a steering committee member of the American Academy of Religion, Innovations in the Chaplaincy and Spiritual Care. Duane currently lives in Southern California with his wife, who is a curriculum editor, and they have an adult son that participates, and all of them participates in the life of Claremont Presbyterian Church. He's also a volunteer fire lookout in San Bernardino Mountains. I follow him on Facebook, so I have the honor of seeing some of those wonderful pictures from on high. He also is an artist building pottery, and he enjoys hiking, rock climbing, and good food. At this time, I'd like to present Dr. Duane Bidwell, our Greenhoe Lecture for 2022.
Thank you, Trina, so much. It is good to see you and good to see so many old friends in the audience, including, I think, my parents. So hi, Mom and Dad. It's good to see you. I think, Cassie, if you can bring up the slides, that would be fantastic. There we go. And if you can shift to the first slide. This is a photo of the foot of San Antonio Falls, which is up the mountain about 20 minutes from my house. And that red stuff at the base is an offering that someone has left at the foot of the falls. And I like to imagine that it is an expression of gratitude, that that offering is because of some overwhelming sense of mercy and generosity and grace that someone has experienced in the world and that they have offered to the spirit of this place. And I want to begin by expressing gratitude to all of you who are here, and to President Pollard and Dean Mumford for the invitation, to Jean Newman and Cassie Turpin for help getting all of this together, and to Trina for this wonderful introduction. Cassie, next slide. I am speaking to you from the unceded homeland of the Keats Tongva Nation. And this photo is looking out across the Los Angeles basin from the fire tower on Keller Peak, where I volunteer as a fire lookout, as Trina said. And I include it here because hope, if you take nothing else from this afternoon, know that hope is rooted in specific times and places. While it might be a universal human experience, its manifestation is very particular, and it has to do with where we are and with whom we are. Next slide. So hope is also rooted in specific people, and this is a photo of one of the sources of my hope, my wife Carrie and our son Ben in San Diego, celebrating Father's Day, actually. So next slide. Scripture tells us to always be ready to give an answer when someone asks about our hope. And I want to take you all to take a minute just to take a couple of deep breaths and ground yourself in the chair, maybe close your eyes, and bring to mind the people and the places, those gifts of God that ground your hope. To acknowledge them, to recognize them, and to imagine the people you're called to serve, for whom you might be, as Don Capps said, an agent of hope. That what we do here together this afternoon might be a blessing not only for you, but for those who sustain you and those whom you sustain. Next slide. So we are here to talk about hope among children with chronic illness. But not just any chronic illness. My research deals with children who have end-stage renal disease, children whose broken kidneys require dialysis or organ transplant for them to survive. Next slide. So before I dive in, I need to tell you a little bit about kidneys and why they're important, and what the context is of the children you'll be listening to in a few minutes. The kidneys are an organ in the central part of your body, and their primary job is to filter out impurities and minerals, and what doctors sometimes say to kids is the garbage that flows through our bodies. They also regulate fluid retention and fluids in your body, and they have a strong effect on your cardiovascular system, your pulmonary, the system that pumps blood, oxygen, and nutrients throughout your body. So kidneys are very important to be able to survive. And if you don't have kidneys that work well, your life is at risk. And if you can't find some way to amplify the work of the kidneys when they're beginning to fail, you will eventually die. So the work that I've done around pediatric hope involves 51 children with end-stage renal disease. That means their kidneys have stopped working. They are at the end stage of kidney disease, and that without some sort of treatment, their life will be at risk. And we interviewed them at dialysis units and transplant clinics in 3 sites in the United States, one on the East Coast, one in the South, and one on the West Coast. So next slide. This is a typical pediatric dialysis unit, and children usually come to dialysis at least 3 times a week for 3 hours at a time to be hooked up to a machine that will cleanse their blood of all those impurities. It is an incredibly boring time for these young people, and it is incredibly invasive. They deal with catheters and ports in their chest and ongoing surgeries. Dialysis creates lots of side effects. The medications they take to sustain their kidneys along with dialysis also creates side effects. So even though the machines are helping their kidneys function and keep them alive, they're embedded, they're soaking, they're marinating in suffering. So these photos that I've shown you are very cleaned up. They show you mostly smiling kids. No one has tape residue on their hand. No one is vomiting. No one is crying. But I want to give you a sense of the unsanitized version as well. So if you were squeamish, I apologize, but I'm going to show you a couple of slides that aren't horrific, but they might give you pause. Next slide. When you are on dialysis, you are connected by tubes to a machine, and the blood in your body, every drop of blood in your body flows through those tubes into the machine and back out into your body 2 to 3 times an hour. Your body is drained and refilled 6 to 9 times during dialysis. And then these kids are expected to pop up and go to school or go to practice or something like that. Some of them dialyze at home, which was the slide you just saw of the tube in someone's side. They have a tube that runs into their abdomen, and for 12 to 14 hours a night, they are tethered to a machine. So you might say that in some ways, kids on, any person on dialysis is sort of a cyborg, right? A human-machine combination. They need the machine to survive. It becomes a part of who they are in the world. In addition to the side effects that these kids face, their bodies are scarred because of surgeries. They have body image issues, sometimes looking different than their peers. And there's a ton of psychosocial suffering that goes with being a kidney disease patient, particularly an end-stage patient who is on dialysis or managing a transplanted kidney. So, next slide. What did I learn from our research partners? Well, there are 5 practices. Cassie, next slide. And one more. Some of these practices are a resource that children carry into the experience of disease. Next. And some of them are a gift that they receive out of their experience of illness, practices they develop because of the environment that they're in and because of the suffering that they're living with. And these practices range on a pole between, next slide, kind of existential issues and meanings that are related to living with a chronic illness. And next slide, existential issues and sociocultural issues. Disease is shaped by the people you're with, by your background, by the resources you have access to, and those kinds of things. So what are these 5 practices? Next slide. First is choosing trust, which is an existential practice that is kind of on the gift-received side of kidney disease. And this is when children develop the ability to decide to trust the treatment team and to trust the medical process and to trust really the universe, that good things are in store for them. Next slide. A second practice is realizing connections, building a community with the people on the interdisciplinary treatment team and with other kidney patients. Next, claiming power. is one of those practices that is halfway between gift received and halfway between resource carried. And it has to do with claiming power in relation to doctors and nurses and phlebotomists, and in relation to the disease, beginning to take responsibility for your own health. Next, maintaining identity is being able to sustain who you believed you were before you got sick. That the disease doesn't take over, or it doesn't erase who you've been in the world and what was important to you and who your primary relationships were with. So maintaining identity is a practice. And then next slide. Attending to spirit. And this is the part of practice where children attend to that which is transpersonal in the disease experience. It's a resource that they bring into the experience of disease, and it has to do with existential dimensions of illness. So today we're focused, next slide, on attending to spirit. This is a dimension of chronic illness and of kidney disease and of hope that is often ignored, or usually ignored, by most theorists writing about hope. They don't look at the ways that religion and spirituality contribute to living well with chronic illness. So we'll talk about that here in a little bit. First, I have to give you sort of a warning about a word I'm going to use. So next slide. When these children talk, we'll do these quotes. These are two quotes from two of the kids in the study. One of them is, "Without God, I really can't do it. It's a lot of burden on somebody my age." Next slide. And then this is from Grady, who's 15. "I talk to God like he's my friend, and so I just pray." Next slide. "In the midst of this disease experience, kids consistently tell me they want to be normal or more normal." And when I first heard that term, I had this kind of visceral response that this was a negative thing, that they perceived themselves as so different from their peers and so different from healthy people that they must be broken or less than, or a problem to be solved. But as I started to listen to them more critically and more deeply, I realized that kids with kidney disease use the word normal as a kind of critical utopia. It's the preferred future that they want to live into. It is the vision of wholeness and health that they hold on to. It doesn't have to do with getting rid of kidney disease. It is the state of being that they yearn for, that in many ways echoes the way that the World Health Organization defines health. Right? Being able to contribute, to have relationships, to have a sense of wholeness and connection, even in the midst of symptoms. So when you hear the kids in the lecture today talking about normal, I want you to hear it in that way. It's this aspirational thing they're trying to accomplish. So next slide. And we can go ahead and turn off the slides, I think, at this point. What I'm offering today is less a lecture than an evocative reading, right? So I invite you to listen to the stories and interpretation of attending to spirit as a hopeful practice. And I'll be reading in part from a manuscript of a book I'm about done with on pediatric hope. So, twice in the same month, 13-year-old Roger got matched for a kidney transplant. Both times he hurried to the hospital, and both times doctors halted the surgery. The first kidney wasn't an optimal match. The second had an abnormality that made it impossible to transplant. Yet Roger says he wasn't disappointed because he didn't expect a transplant to happen either time. "At that time," he says, "I didn't think that I will get a kidney. I felt that it was not a good time, or at that time, it was not the time to get my kidney." Months later, asleep on the living room sofa, Roger was jolted awake by a 3 a.m. phone call. He answered before his parents, and it was the hospital's transplant coordinator. "Roger," she said, "we have a kidney for you. Can you come to the hospital? This time, Roger had no doubt that surgery would happen. He woke his parents and headed to the car. I felt like hope, he says, like I will get my kidney, and it was going to be a good kidney for me. And it was. Roger tells me he was confident that day because of a dream. I always told God that one day I will get my kidney, Roger says. Before I got my transplant, I always dreamed with God. I was dreaming with him, and I remember that he told me that he showed me a kidney, like in my dreams. He showed me a kidney. He showed me a kidney, and he told me that was my kidney. And like a week later, they called me like 3 a.m. in the morning, and I went and I got my transplant. When I first started learning about hope, I was surprised that few researchers mention religion and spirituality. People rely on spirituality during difficult times. In fact, positive religious coping, collaborating with God, forgiving others, perceiving God as benevolent, feeling God's presence in the midst of suffering, that kind of positive religious coping leads to healthier and more effective responses to trauma, abuse, and other negative experiences. But secular researchers seem to ignore the relationship between hope and spirit. I'm not certain why that is. It could be discomfort with the language of spirituality and religion, or a failure to recognize it when they hear it. It could be the difficulty of dealing with the issue of suffering from spiritual and existential perspectives. Hope researchers give attention to philosophical virtues and social support and cognitive skills and positive emotions and coping strategies. But outside of the academic discipline of theology, very few explore how people's spiritual and religious commitments shape their hope. Even Christian theologians who talk about hope focus more on philosophy, doctrine, and psychology than personal spiritual experiences and practices. Yet children, when they talk about hope, reference religion and spirituality again and again. More than 2/3 of the young people in our study say attending to the presence and action of spirit helps them sustain hope. Connecting to spirit seems to be a skill and resource that sick children bring to chronic illness. It's cultivated long before diagnosis. And while children rarely volunteer this aspect of experience to healthcare workers and other professionals, if you ask about it or follow up when they use the word God, they engage eagerly. 12-year-old Max, for example, is a transplant recipient. He told me that God used his ancestors to give him confidence when doctors had to remove both of his kidneys. When they told me I was getting my kidneys taken out, he says, I said, how can I live without kidneys? That night, his deceased great-grandmother, a West African immigrant, came to him in a dream. My great-grandma, in the spirit, she's in my dreams talking to me, he says. That's when I found out it would be okay. He says that God spoke to him through his grandmother. I thank God for telling me that, Max says, because I thought I was going to die. He told me, you're not going to die. He is going to be the one to take care of me, and I'm going to live. Don't worry. For children like Max, attending to spirit marks a shift in the ways they sustain hope during illness. Immediately after diagnosis, they turn outward, realizing connections with the treatment team and claiming power in relation to treatment and disease. But eventually, children learn that connections and power alone cannot sustain hope. No matter how many connections they make, there are times they still feel alone. No matter how much power they claim, they can't change or influence everything. In particular, the vision of normal that motivates them to imagine new possibilities and work toward health cannot be realized through their own efforts. Normal exceeds their capacity to create, and they begin to sense that they will always be abnormal to some degree. Aware of loss, fearing death, and recognizing human limits, many sick children respond by turning toward an inner, transcendent source of affirmation, empowerment, and consolation. By attending to spirit, sick children sustain hope when human power isn't enough and normal remains beyond reach. All kids have that one feeling that, when you're there, it's just, you want to smile or something, says 13-year-old Gina, a dialysis patient. You just want to be there, and you just get that nice, relaxed feeling relaxed all the time. God is always there for you, even when you don't think he's here. Among the children I spoke with, girls and boys attend to spirit in equal measure. But the practice seems especially important among Black and brown children. 85% of them name attending to spirit as an aspect of hope, compared to 15% of white children. This is consistent with data that indicates Blacks and Latinos in the United States are more likely than whites to pray, believe in God, and say religion is important to their lives. It's also consistent with studies that suggest spiritual well-being plays a greater role in illness among Blacks and Latinos than among whites. So what does attending to spirit mean? I'm talking about the attitudes and actions that define a child's relationship to a transcendent goodness, however they understand it. Spirituality shapes a person's image of God and ultimate reality. It informs the way they pray, how they connect and attend to spirit, what they believe about serving others, and the importance they place on community. Spirituality is, as Benedictine nun Joan Chittister says, the filter through which we view our worlds and the limits within which we operate. The ways people talk about and express spirituality can reveal a lot about their assumptions about ultimate reality, what it means to be human, and the relationship between the two. Some people describe spirit as distant or even separate from the world. Others think it acts directly in the world and in their lives. Some people talk about spirit from an experiential or kinesthetic perspective, as Gina does. Others talk about spirit from intellectual or ethical perspectives. As I listened to children in our study talk about spirit, I tried to identify their assumptions. How does this child think about people and how they should listen for guidance from a transcendent source? Does this child believe humans can hear and see God? What spiritual disciplines or practices, prayer, pilgrimage, art, music, rosaries, sacred texts, what disciplines or practices are useful to particular children, and how do they engage them? What does this child assume about how God thinks, acts, and feels? What about the characteristics of ultimate reality? What I found is that children with chronic illness describe three consistent ideas about spirit, its characteristics, and its interactions with them in the world. They focus on faith, the nature of God, and prayer. So let's look at faith first. Riley, 14, started coughing a few days after her most recent birthday, and her parents thought she had a cold. But the cold didn't go away. Then Riley started throwing up, once or twice a day at first, but sometimes as many as 5 times. On the Friday after Thanksgiving, her parents took her to the emergency room and learned that her kidneys had failed. Riley was admitted to the intensive care unit where she had a seizure. She stayed there for a month, undergoing chemotherapy to suppress her immune system, to slow the attack on her kidneys. I was just very scared, Riley remembers. I told my mom, I feel like dying, feel like I'm going to die. But then she felt a presence in the intensive care room. She and her mom saw a tall, beautiful angel in a corner of the room. The angel was praying and infusing Riley with healing energy. You could feel his presence, Riley remembers. It wasn't such a fabulous, great, exciting feeling, but it was calming and peaceful. And it was absolutely no fear. Now, 6 months later, Riley goes to the hospital 4 hours a day, 3 times a week for dialysis. She says no matter what happens, God will keep her going because she has a purpose. I have hope through God, she says. God didn't take me this far just to let me die. I know that God put me in this position so I can make a difference in people's life, just a difference in their world. I know this is for reasons. So I keep hope, knowing that every day I'm going to survive. Just kind of knowing that through my whole life, that's why I have so much faith in God. No matter what, it's I'm going to make it through because it's there. He's got me. Riley and other children say hope depends on faith. Faith in God, in goodness, in others, and in possibility. It isn't a blind faith, trust in something they've never seen or experienced. They validate and sustain their faith through concrete evidence that things can and do get better. Sick children point to positive laboratory results, rising energy levels, activities they can do again, or maybe for the first time after treatment, and support from friends and families. They attend to tiny advances, small positive changes in health, attitudes, feelings, and relationships as evidence of goodness, and their faith increases. Sometimes it's as simple as seeing that members of the healthcare team expect improvement and trust that it will happen. If doctors believe, so can children. For the children I talk with, faith isn't a capacity they develop, something that comes naturally from within. It is a gift from the ultimate itself, the goodness at the heart of reality. Spiritual practices like prayer or service or ritual or reading sacred texts, those express faith rather than promoting it. Practices are a response to the gift, not a way to claim it, and a way of staying in relationship with goodness. This type of faith carries children through trials. They trust things to get better, and they fall back on this belief when they face tough challenges. They remain positive and happy, they say, because they have faith that things can and will improve. There's a steady element of trust in the words kids use to talk about faith. Faith doesn't eliminate their trials or negative feelings. Children emphasize that you can be scared, angry, hopeless, and still have faith. And they say that not everyone is aware of faith, even when they have it. Some children talk about faith as a feeling, an internal state. What they say expresses a trust in possibilities both finite, like a transplant, and transfinite, like a supreme being or eternity in heaven. Some children suggest that transfinite faith precedes hope. For them, spiritual awareness is a condition for experiencing hopefulness. Listen to 15-year-old Leo, a dialysis patient. God is here with us, Leo says. If I die, I'm okay with God. But like some of the kids, they have hope, but they don't have faith. They're scared to die. No matter what, having hope and faith, they'll be until you die and lose everything. My faith is that I have faith in God, and he'll help me with transplant. He'll help my mom to get the money for kidney transplant. The object of this is a transcendent reality, a benevolent partner most of the kids in the study call God. Enrique is a tall and slender 15-year-old, sprawled in a chair at the transplant clinic, his thumbs dancing on PlayStation controls while digital soccer players kick a ball across the screen. For a decade, doctors managed Enrique's kidney disease with medication. For most of his childhood, he didn't think about being sick. He played with his cousins, roughhoused on the basketball court, volunteered at church, and hung out with friends. But a year ago, his kidneys suddenly failed. Doctors told his parents to put him on the waiting list for a transplant. He'd need dialysis until a kidney became available. My mom signed me on Friday onto the transplant list, Enrique says. And then they called me on Saturday, the next day, just one day, and they gave me the transplant. It's like a second chance. Hope is like something like you have a feeling that you're going to accomplish something. They're going to give you something. They're going to give me a kidney, and I wouldn't go on dialysis. Enrique says he wasn't surprised by the speed of the transplant because all of his life, something bigger than himself, his family, and his church has watched out for him. Sometimes, he says, you have a feeling like you're protected. You're wondering that nothing bad is happening to you, like you have God or an angel or something. You get the feeling that something is protecting you and all that. When you have that feeling, I think it was like God or something, an angel. Sometimes I feel it. Sometimes I just know. Children like Enrique don't just have faith. They express faith in something, which they tend to call God, but they experience it through events in the world, through synchronicities, and through a confidence that there is a power working for good on their behalf. It's a personal power, one that stays in relationship with them, communicates, and sometimes sends messengers like angels, ancestors, and physical sensations that provide comfort, consolation, and confidence. Above all, that power, God, hears and responds to their concerns. Everyone should be able to talk to God, says Nick, 17, a transplant recipient. They could talk to him right here. You may not have seen, or you may think he's not hearing me, but he hears all of us. He heals you too, physical, and he heals you in emotion. He heals you anytime in a way that you think you need. Children who attend to Spirit talk about God in consistent ways. God is good. God hears their prayer. God listens to them. God can be felt and known through their bodies. God lives in them and acts on their behalf in the world. God watches over them. And God makes demands, asking them to participate in healing rather than waiting for God to do it all. He is like the voice in your head, Nick says. He's the voice in your head that says, I'm going to make this happen. But in order for me to make that happen, you have to make this happen. So he told me, in order for you to get this kidney, you have to be patient and live your life as if you have 2 kidneys. And I did. I said, okay, I'm going to do that. This relationship, though, isn't all puppies and rainbows. Children trust God and they blame and rage at God. They describe a dynamic give and take relationship with goodness. God, for some, becomes an intimate friend, the most intimate and trustworthy friend ever. They can be honest with God, and so they are. They say they must be honest with God because God remains faithful to them no matter how they feel or what they say. Now, this becomes important to children as they ask the types of difficult questions that haunt some suffering people. Why did I get sick? Why is this happening to me? Am I sick because I'm a bad person? Is the universe punishing me or teaching me a lesson? If God is good, why does suffering even exist? If God can do anything, why haven't I been healed? Do I deserve this pain? If I pray hard enough, will I get better? If I don't get better, or get a transplant, or tolerate my new medication, or get through dialysis without feeling like crap, does that mean I disappointed God? Am I getting sicker because I'm angry? Why isn't treatment working? No one can resolve these spiritual and existential dilemmas, of course, at least not adequately or forever. But feeling safe and accepted enough to express these types of questions to God goes a long way toward helping sick children and adults cope with physical, spiritual, and psychosocial suffering. When I had the kidney disease, before I was on dialysis, and even when I was, Honestly, I used to blame God, says 18-year-old Andrew, a transplant recipient who's had kidney disease since infancy. I kept asking God, why can't I be like my friend, be healthy and not go through this and just not be on all these meds and catheterizing all the time? I would tell myself that I was tired. God was punishing me, but I would never know why or what he was punishing me for. I would never know why. I thought he was punishing me because I had kidney disease. My grandma died. Then my sister died in the same year. I thought he was punishing me, taking the things I loved away. He was punishing me for something, and I just never knew what. Andrew shared his bitterness with his parents and with a church member. The church member prayed with him and suggested a Bible verse about Jesus casting away evil. As Andrew reflected on the verse, things started to change. Being honest about anger, he says, allowed God to respond and speak to him through sacred text. The verse helped him imagine how life would be when God took away the things that evil had put him through. It gave me more hope, Andrew says. God was giving me a brighter light to walk in. Since then, I got the transplant. 13-year-old Audrey, a Mormon, also gave God a piece of her mind when her kidneys failed despite dialysis. She and her family read scripture and prayed daily, asking for a blessing, a donated kidney. But when the kidney came, doctors canceled the transplant because of a problem with the donor's blood. I was totally frustrated, Audrey said. I just got so angry. I got frustrated. It seems to me that nothing worked and that God was not helping me. Audrey and her family continued to pray every day, asking God for a blessing. One day, her dad asked why she was so mad. I told him my kidneys aren't functioning. God's not helping me, she says. Her dad explained the transplant process and urged her to continue praying, especially for the person who would donate a kidney for her someday. Audrey received a transplant a few weeks later. Evidence, she says now, that God does bless her and will bless her in the future. I thought I was not going to come true, but it did come true, Audrey says. At first, I thought God didn't exist, but from that, he does exist. It did help me a lot, and he's blessed me a lot, and he's been taking care of me and being safe and healthy for my kidneys. I ask her what she carries away from that experience. Believe and trust God, Audrey said. Believe and trust God. Don't be afraid. Don't be afraid. I pray and trust, and that helps. Audrey's reliance on prayer reflects a third element of attending to spirit. Children with chronic illness use prayer to connect to goodness and to express and to sustain their faith. So prayer, especially prayer with other people, is the primary way sick children attend to spirit. They pray in community with members of their church, mosque, synagogue, or temple. They pray at home and over the phone with aunts, uncles, grandparents, and siblings. They pray digitally with strangers, friends, and other kidney patients. They pray with religious leaders privately and in public, and they pray alone in their hospital beds at night. They pray about illness, and they pray for others. Engaging in prayer comforts sick children. It calms them, clarifies their feelings, and keeps them connected intentionally to spirit. Prayer becomes a way of claiming power and influence in relation to the divine and to issues that transcend illness. Praying gives me hope to believe that God will bless you through the illness, says 9-year-old Maggie, a transplant recipient. Believe that God will bless you through it no matter what happens. I pray before I eat and go to bed every day. I pray before I go to my classroom. He blesses me with the health issue I had, and he's going to bless other people with the issues they have. She especially prays that the donor of her transplanted kidney, an aunt who teaches her to attend to spirit in the midst of everyday life. But sustaining that attention isn't easy. Prayer slips away in the midst of busyness. An awareness of God can evaporate in the pain and stress of treatment. I have definitely felt more like of God's presence than I ever had before, says 14-year-old Riley. It's kind of like hard. It's hard to stay aware of God because I'm just like constantly like things are going on, and it's really hard to like stay focused on God, pray and go to church and stuff. But when I do have like times to just like pray and stuff, it's just like, I'm sorry that I'm never like there, like talking to him. But when I do have the time, it's just like, it's great because I really do like feeling him, you know? Like I never have felt him like that before. It's a knowing feeling, right? It's just like, you know it in your head. You know that everything's going to be fine and you feel like everything's going to be fine in the end. God didn't take me this far just to let me die. Like if I'm going to die, it's going to be like, I don't know, like when I die, it's going to be like when I'm old. Because I know that after this, I really want to do something. Like I want to do something like counseling, or I want to be part of like Make-A-Wish Foundation. I want to make a difference in people's lives and stuff. Prayer also involves clutching a rosary or fingering prayer beads during dialysis, volunteering to help others in and beyond the hospital, wearing religious jewelry, worshiping with others in community, reading sacred texts, singing gospel music, visiting prophets and fortune tellers and curanderas, and taking part in rituals. When 14-year-old Amber, for example, goes to the transplant clinic, she wears her grandfather's mother of pearl cross. When her grandfather died, Amber asked her grandmother for the necklace. And feeling the cross against her skin reminds her of her grandfather's strength during his own cancer treatment. He used to wear it when we were out with him and when I went to the doctor, Amber says. It reminds me to have faith. To me, hope is something like faith. What these young people describe is what psychologists call spiritual and religious coping. Actions, feelings, thoughts, and relationships that help them make sense of life and deal with it in the context of the sacred. Any dimension of life recognized as carrying transcendent or divine meaning. The sacred provides a sense of connection, transcendence, and meaning. It becomes a filter or lens for making sense of experience. People who use religion positively feel securely related to a transcendent force. They feel spiritually connected to others, and they see the world as a safe, benevolent place. They look for a strong connection to God, actively seek God's love and care, collaborate with God to put plans into action, identify how God strengthens them in particular situations, ask for forgiveness, and turn to spirituality to stop worrying about problems. People who engage in these activities have fewer psychosomatic symptoms in the present and show spiritual growth in the future. Negative religious coping involves behaviors like wondering if God has abandoned you, feeling punished by God, questioning God's love, wondering whether your religious community has abandoned you, attributing events to the devil, and questioning the power of God. People who use religion in these ways show increased psychological distress, poorer quality of life, and greater callousness toward other people. From a psychological perspective, these negative ideas could, quote, reflect underlying spiritual tensions and struggles within oneself, with others, and with the divine, end quote. Children who nurture hope by attending to spirit demonstrate both positive and negative religious coping. Some, like Andrew, feel that God uses illness to punish them. Others feel abandoned, believe God expects impossible things for them, or worry that insufficient faith leads to rejection. Yet religious coping is rarely all positive or all negative. Usually it's both at once, and at any given moment falls on a continuum between the two poles, more negative or positive, but not entirely one or the other. Andrew, for example, thought God was punishing him, negative coping, but turned to his religious community, prayer, sacred text, and meditation to overcome that limiting and harmful belief, positive coping. But among the children who talk with me, religious coping tends toward the positive, which makes spirituality a vital resource for hope in the midst of chronic illness. Research tells us that at its best, religious coping reduces anxiety, empowers people who are on dialysis, and increases an ill person's ability to care for themselves. Bringing spirituality into dialysis can reduce stress, improve quality of life, enhance sleep, reduce fatigue, and increase compliance with treatment. It can also improve spiritual wellness, enhance self-esteem, and strengthen feelings of agency. A lot of studies correlate spiritual well-being with a person's capacity to hope. When psychologist James Gabarino and his colleagues, for example, studied children in war zones around the world, they learned that children's spirituality protects them from the effects of trauma, and that children who interact with adults whose spirituality gives meaning to suffering ultimately cope better with violence than those who lack those adult relationships. If spirituality can be a protective factor in the midst of chronic violence and chronic trauma, why wouldn't it be a hope-sustaining resource in the midst of chronic illness? 17-year-old Diamond felt isolated most of her life. She grew up in a military family, and the Navy moved her dad around a lot. That meant changing schools every year or so, and it was hard to make friends. Plus, her primary illness, the autoimmune disease lupus nephritis, often kept her out of school, especially after it affected her kidneys. She'd known since elementary school that lupus could cause kidney problems, and 3 risk factors increased the chance of that happening to Diamond. She was young, Black, and female. Her kidneys failed by the time she turned 12, and doctors removed them surgically. Diamond started dialysis, but surgery led to an infection. The infection led to a seizure, and the seizure left her non-responsive for weeks. She spent 3 months in the hospital. The whole time she was unconscious, her aunts and grandmother made sure at least one person prayed beside her bed around the clock. Diamond says faith and prayer sustain her hope. That and knowing God will never abandon her. You have to have faith that God does stuff for reasons, she says. He takes you through things so you can be a testimony to somebody else. You get through whatever that you're going through. You can tell people how, like, people are going through something similar or the same thing. You can tell them how you got through it and how you can work it out and how you worked it out. You can try to make their trial more easier than what you've been through. Diamond says attending to Spirit isn't easy, but it's necessary. It gets hard a lot to keep your faith because it's hard to deal with, she says, but you just got to pray about it. I do lose my faith sometimes, but I have family that helps me get through it. When Diamond feels faith slipping, or when she feels like God is distant, she prays for a stronger connection and stronger belief. She learned to pray from her oldest auntie, who taught her when she was a child. Now Diamond prays several times a day, silently when alone, and out loud in person or over the phone with her aunties, grandmother, and church members. Prayer reminds Diamond that God wants her to be a testimony to others, that her suffering has a purpose. God put everybody here for a reason, she says. When he put you here for a reason, he wants you to do it because that shows a meaning in life. Everybody has their own feeling of what hope is because people go through different things. Some people let their illness get them down, like I do sometimes. They just seem depressed. They seem like they have a cloud over their head. But these hopeful kids, they don't let their illness get through. They talk to other people their age. They're very active, energetic, just they feel good inside. Diamond's story points toward consistent, positive religious coping. She collaborates with God, connects to others, seeks divine love and care, feels communion with transcendence, and finds purpose in her experience. Her story also illustrates a hallmark result of attending to Spirit. Turning inward to access spiritual realities and resources leads sick children outward again with an expanded perspective. In turning to Spirit, they tend also to slowly look beyond the treatment room and personal concerns to engage the world and the concerns of others. In the beginning, sick children focus on outer resources, seeking personal health and comfort from the people and activities around them. They strengthen their sense of agency and influence in relation to the treatment team and the illness. But as they experience the unpredictable and uncontrollable nature of illness, they realize that their lives will never be normal in the ways they desire, no matter what they or others do. Human power cannot domesticate kidney disease. And this realization causes many children with chronic illness to seek spiritual power as an ally. Seeking consolation beyond the human, they grasp that goodness loves and values them, whether or not they are normal by their standards or the standards of the world. This insight turns them outward again with a new sense of compassion and empathy. They pivot beyond themselves and beyond the transplant clinic or dialysis unit to offer their gifts to the world by giving care and support to others. Purpose sustains hope, and children discover purpose in part by attending to spirit. Because of the disease, says 15-year-old Leo, you learn things to use to help other people who are sick. Leo's insight points toward the relational dimensions of chronic illness. Hope, for the children who talk with me, isn't a feeling or virtue or individual resource. It's a shared asset, deeply connected and entangled with others, an ability to influence relationships, and a nascent awareness that goodness expects them to participate in and contribute to the flourishing of others. I understand it this way. Attending to spirit creates contemplative space in which sick children can attend to, identify, and claim how illness equips them to benefit others. By placing their personal illness in a broader, transcendent context, they claim a sense of vocation shaped largely by the landscape of illness, a compassionate, altruistic commitment to easing the burden of sick people and those who are temporarily well. Learning to attend to spirit is itself a product of relationships and altruistic commitments. Most sick children talk about a wisdom figure, a grandparent, aunt, pastor, hospital chaplain, or family friend who taught them faith and coached them in attending to spirit. These are people present in the midst of illness, not to attend to the details of treatment or pay the bills or worry about transportation, but just to be with sick children, taking time to listen, to encourage, and to introduce children to spirit in behavioral ways by teaching them to pray, to rely on scripture, to trust the goodness of the world. Wisdom figures offer guidance, presence, and consolation to children, usually through relationships that begin long before diagnosis and the onset of chronic illness. They offer a perspective that models for sick children how to make positive spiritual or religious sense of pain and suffering. They help children understand faith as a partnership, not only between people and God, but also between people and broader communities. Congregations and other spiritual communities mediate the consolation of spirit by visiting children in the hospital, sending them gifts and cards, or emailing them to check in or offer encouragement. Wisdom figures matter because children initially trust goodness because other older people trust it too. Sick children trust their own ability to cope with illness because others voice confidence that children can cope with the help of God. In the end, children have faith not only in God, but also in the people around them. Relationships with wisdom figures mirror, model, and create the faith and trust that children place in God. So what do I take away from this? 3 things. First, children know that hope can exceed human capacities, drawing from powers and realities beyond, yet glimpse through the material world. The transpersonal dimension of hope also reveals something about humanity. We are larger than our material biological bodies, embedded in a matrix of relationships and energies that exceed awareness. These relationships and energies call us to a purpose beyond ourselves and bigger than our egos. We not only create identity, power, and meaning through action, but receive them from sources larger than our personalities and communities. Hope and humanity need imagination, intuition, and transcendent intimacy. Children seem more aware than adults sometimes of the transpersonal aspects of hopefulness and meaning that sustain human thoughts, actions, and relationships. Second, spirituality, spirit, and religion matter tremendously in the midst of chronic illness. Kenneth Doka, who is an expert on death, dying, and bereavement, says chronic life-threatening illness at its heart should be understood as fundamentally a spiritual crisis, a time when people are focused on making meaning, finding hope, and facing death. Chronically ill children sustain hope in part by attending to spirit when human power proves insufficient. I'm puzzled that contemporary psychological, philosophical, and educational conversations about hope pay so little attention to spirituality. This illustrates the importance of paying attention to the voices and experiences of children in understanding what hope is and how it manifests in people's lives. Third, the children who talk with me suggest that the practice of attending to spirit manifests primarily through relational avenues and through an open, receptive, reflective attitude, activated through religious and spiritual practices like prayer, worship, visitation, blessing, and the reading of sacred text. Wisdom figures and material religion, that is, objects, ritual, communities, and practices, matter a lot to children. They often attend to spirit for instrumental reasons, making it a means to an end, like using prayer to manage anxiety during a medical procedure, but they also emphasize its personal and communal significance. They speak intimately and personally of God's availability and presence in the midst of illness. Attending to that presence assures them of the goodness of life and the benevolence of the world. It keeps them connected to important relationships with people living and dead, nearby and at a distance. It gives them a sense of agency, and it turns their attention outward to something larger than kidney disease. I've learned from children that attending to spirit involves learning from, practicing with, and valuing others in formal and informal spiritual communities. Adults need to help children attend to spirit, equipping them with the knowledge and skills it requires and encouraging relationships with wisdom figures. Consolation comes through spirit, but usually clothed in human skin. We receive divine consolation through the people in our lives, and children know spirit first through relationships with family, friends, and caregivers. Understanding who God is and how God acts assures sick children that ultimately the world can be trusted, that God is good, present, active, and works on their behalf, allows children to choose trust in the midst of pain, suffering, and ambiguity. It nurtures a sense of abundance, a confidence that they will get what they need even when they and their families cannot provide it all themselves. Knowing that they are loved and valued even when they cannot be normal in the ways they yearn allows children to claim the gifts and wisdom that emerge from their experiences of illness. Thank you.
Thank you so much, Duane, for that wonderful lecture. This is our opportunity to engage Duane in any questions that you have about his lecture. His wonderful lecture is full of really important information about chronic illness and caring for children who are hopeful as they are undertaking that journey. The process, those of you who are present on campus have the ability to ask a question. I think someone is there to facilitate that process. If you're in the virtual room, you have the question and answer area that you can submit your question, and we will share that question with Dr. Bidwell so that he can answer any questions that you have.
There's the owl.
So once again, if you have any questions and you're in the virtual space, if you're in the Zoom room, the question and answer area, and you will type your questions there. We'll fill those questions for Dr. Bidwell to answer. And if you're looks like we have a number of people in the watch party, so there are questions there. We are happy to take those questions at this time.
Question back here. I have a question. My name is Holly Williams. Thank you so much for joining us. I took wonderful notes that I have no doubt will serve me as prayer and things to ponder, as well as things to use when it's not just chronic illness, but I find myself as a pastor dealing with pretty chronic emotional exhaustion and a general broken society, grieving so many things deeply these days. Did I hear, this is the question, and thank you for the feedback that I gave you as well. Did I hear the experiences wherein the patients go about these practices or encounter experiences on their own, as well as tend to have the seeds and the openness for these experiences given to them because they are connected to those families and communities that they.
Yes. So spiritual resources and practices begin outside of us, right? We receive them from our communities and the people around us before we internalize them to use on our own. So children learn those things somewhere. Now, some of them learn them from celebrities or from the internet or from watching other patients. I was surprised by the number of kids who say they teach each other to pray. So they use them on their own, but they have a root somewhere in this connection. Some kids also develop their own rituals, right? They feel called somehow to communicate, and the forms of prayer or practices that they've learned aren't sufficient for them. So they come up with their own ways of doing things where they make a motion or a physical gesture, or they write something down and tear it up and throw it in the air, or those kinds of things. So if I understood your question, that's how I would respond. Now, tell me if I got it.
Forming it even as I was expressing it. So thank you for the ways that you responded. Yes.
Great.
It's a lifelong journey too.
Yes.
Biblically speaking, Samuel hears God and thinks it's Eli, as does Eli. So in part, given this journey and your experience and knowledge, I wanted to hear a little more of that initial or ongoing tendency to find yourself in the midst of such experiences and capable and leaning into those practices. I didn't give you a very concise question at all, but I loved your answer, so thank you for that.
Thanks. It's easy, I think. You know, I was walking through the unit one day, and a girl that I had interviewed earlier stopped me, and she asked me what I was hearing from other kids. And I said something like, oh my gosh, y'all are teaching me a lot. And she said, we could teach you adults a lot of things if you would listen to us. And what I learned about this attending to spirit with these kids is that it's really easy for me to colonize their experience with my read on what it is. So if I see someone working a rosary, I assume they're doing Christian prayer and that they got that rosary from a church. But I need to be curious and ask, tell me about the beads. Who'd you get them from? Who do you think of when you're using them? What are you doing when you move the beads? Why is that important to you? What difference does it make to you? Then I get the insights of kids, and they can move beyond the Sunday school language that they've been given and begin to speak in their own language, right? And I think one of our challenges is not to colonize kids with adult experience, but to help them find the words or the motions that whatever it is they use to communicate, help them find the way to do that for themselves, and to not be limited to what we tell them those actions or practices mean. Kids are incredibly creative. They are some of the best exegetes of scripture I have ever met. Because they don't already have, stop signs that tell them don't go there. They'll often take you places you are just surprised to find yourself at that are incredibly generative. So a part of it is also allowing ourselves to be taught by children. Apprenticing ourselves to their experience. And one of the things that's true, one of the reasons I'm writing this book is that almost all theory about hope in theology, in philosophy, in psychology is based on adult experience. And children don't experience things the same way adults do. In fact, adults tend to talk about hope as having to do with the future. And most kids think of hope as having to do with the present. Right? Kids developmentally aren't in a place where they can project into much of a future. Chronically ill people aren't in a place where they can project much into a future. If hope is a future construct, then we're saying people who don't imagine the future are limited in how they hope. But we know that's not true. Right? Anyway, you're getting me on a soapbox and I'll just keep talking. So I'll stop and see if there are other questions.
Thank you so much.
It's a really good soapbox.
Yeah.
I think there's a question in the chat, but I have a question too.
We have a few questions in the chat, so I'll share one of those and then we'll take another question in the room. The first question is, first of all, gratitude for your presentation. I'm a pediatric chaplain in Nashville, Tennessee, and I'm curious if any of the patients in your study, or if in your work you have encountered a person whose hope for cure or God is going to cure them is perhaps at odds with the medical team. If so, what did it look like or how did it manifest itself?
Sure. I don't think you can be a hospital chaplain or even a chaplain resident for more than a day without encountering someone whose hope that God will heal them is at odds with what the doctors say. If Lisa, if I understand what you're asking in terms of how did it look like or how did it manifest itself, it's those people who insist that God will heal them, even though the doctors say there's no hope. So I'm thinking of an example. When I was a pediatric chaplain, there was a stillborn baby in the ICU, the PICU, that was on a ventilator, and the hope was that they could harvest organs, but the mother's family was from a religious community that believed God was going to bring that child back to life. And they filled the atrium of the hospital with church members day and night, singing hymns very loudly. It was disruptive to the rest of the hospital. They refused to let certain people in to see the baby because they thought the negative energy would cause God to not raise the baby from the dead. Even those people eventually accepted that this baby wasn't going to live. They insisted that when the ventilator came off, the baby would begin to breathe, and it didn't. So they immediately began to talk about healing in a different way. That it wasn't about the baby beginning to breathe, it was about the baby having been healed in a different way. And I think that's often the case. We hear talk of people saying, God is going to heal me. God is going to make it better. I don't care what the doctor says. And we interpret that as being at odds with science, or we interpret it as being adversarial to the medical position when it's not. People will make meaning of it in ways that align with what they believe. And again, if we can get curious about, tell me what healing looks like. If the cancer doesn't go away, what would healing look like? And one of the reasons I wanted to talk to kids with kidney disease in this work is they're never going to get better. Kidney disease is a chronic illness. They can manage it, but they can't get healed, right? Even a transplant in a child, like transplant lasts 15 years. They're going to need another transplant someday. And I did talk to kids who had a second or third transplant or received a transplant and then their body rejected it. For me, these children have very little reason to hope in medicine, right? They're not going to get cured. Even the medications they have to take to sustain their kidney transplant make them sick. They have headaches, they vomit, they have dry, scaly skin, they have muscle aches, they have cardiovascular problems. A child who is on dialysis in grade school, by the time they're in their 20s, they have the cardiovascular system of an 80-year-old. Their life is so truncated by these finite effects of the illness that then I was curious, what does healing look like for them? What is hope for them? They know they're not going to get better. They know their life is shorter. So how do they envision hope and what it means to be well? And I'm moved by for how many of them healing means living well with illness and helping other people to live well with illness, that their commitment to mentoring each other, to being there for families whose children are newly diagnosed. These kids are like ambassadors, and the smart hospitals really kind of formalize that and make them ambassadors. They introduce new families and new children to really sick kids to help them make sense of what's happening to them and to understand the culture of the unit. I'm wandering far afield, but yeah, I think that what you're talking about happens a lot. Sometimes it can be really, really bad.
Thank you, Duane. We have a few more minutes for a few more questions. Someone in the room raised their hand, had a question.
I was just wondering, you were speaking about being a chaplain. I was wondering if any of the kids referenced walking a journey with a chaplain, as we have a number of students who are considering chaplaincy.
Yes, absolutely. The kids, and not all of the kids, but a number of the kids will talk about chaplains, or that minister with the hospital, or child life staff who help them learn to walk with this disease. So spiritual care is enormously important to these kids, particularly because these aren't your normal one and done hospital visits, right? I'm in 10 minutes and I'm out. These kids are in the hospital 3 times a week, every week, 52 weeks a year. So there's a chance to develop an ongoing relationship with them and with their families. And that's especially important when they begin to transition from pediatric care to adult care. A lot can fall through that crap, and a chaplain can be a really helpful advocate for helping families and children make that transition. So I noticed there's another comment in the Q&A that I'll go ahead and answer from David Cobb. Hi, David. We've known each other for a long time. David writes, I noticed you didn't dwell on resilience. Thank you for this. Healthcare professionals occasionally downplay the long-term effects of childhood illness by saying, oh, they'll get over it, kids are resilient. I hear you speaking about the ways children do the work of developing hope, which adults shouldn't simply assume kids do easily. Absolutely. Kids are resilient. I used to say children bounce. But they bounce with scars, right? And one of the things we know from trauma work is that trauma never goes away. The triggers never go away. And it's the same with chronic illness. Those illnesses are inscribed in their bodies, in their relationships, and in their attitudes. And to assume that a kid is going to make it through it okay without support, I think is somewhat naive. The thing is, kids have a really remarkable ability to ignore the people who aren't helpful to them and to latch on to the people who are helpful to them. And I don't want to say that's sufficient, but I do trust it when I encounter a family that I think this family just is not dealing with this illness well, and they're not helping the kid deal with it well. That kid often finds someone on the treatment team who will model for them a different way of thinking about disease and health and illness and what it means, what they can do with kidney disease, right? You can't join the army or be a professional football player, but you can still be a police officer. Let me introduce you to an adult police officer who's on dialysis, so you see what's possible, right? It's also amazing. A lot of these kids will say they never realized that adults could have kidney disease until their principal or their teacher showed them their scar from a kidney transplant, right? So they begin to recognize their tribe, if you will, out in the world. Other questions?
I had one, Duane.
Yes, please.
So do children, do they have the fear of death the same way adults do? And I'm just kind of wondering, with these kids who are faced with life and death, yet still have hope and resilience, have you been able to discern how they look at death, how they perceive death? Very often as adults, we think it is the worst outcome. And do the kids think of it the same way as we do?
How long do we have? A dialysis unit and a transplant clinic are, the reality of death is always in the background. They can be fun, happy places, but that can spin from, a staff member can spin from being playful and joking with a kid to doing something life-saving in an instant. Everyone knows the stakes are high. Sometimes anxiety is higher than at other times. And even the youngest kids have a sense of that. They might not be able to articulate it as a fear of death, but they know something serious is going on here. But as they get older, teenagers and boys especially talk about their awareness of death. And it usually has to do with, I have things I want to accomplish or people I want to connect with before I die. It's not the rigid fear of death necessarily that you see in some adults. But Dr. Mumford, I would also say two things. People tend to die the way they live, right? That at the point of death, what you will see is magnified the habits and attitudes and anxieties or relaxations that a person had in life. And kids who are trusting and who believe that there is support there for them and that people are looking out for them will not be as anxious about death as kids who've been abused or who don't have access to things. And kids, particularly younger kids, they respond to the threat of death in the ways that they see modeled to them by the people they care about. And so if you are a parent, it's really important for you to get clear on your own attitudes about death and illness and sickness and health, so that you can model for your kid what you believe, and they can begin to live into that. If the child sees that the aunts and uncles and grandparents are terrified and anxious and terribly upset about the possibility of death, then that's how the child will respond emotionally. If they see adults who are able to say death is real, but it doesn't have the final word, and you're not going to die today, then kids will adopt that. I think you heard that in some of the kids I was talking to in what I read today. Yeah, great question.
Thank you.
Yeah.
Duane, there's another question, and this will be the final question as we're wrapping up.
Okay.
Reverend Kate Pyle, Reverend Kate Pyle has a question. Can you see her question?
Oh, I can if I go to the answered questions.
Yeah, and it looks like it got marked answered. I don't know why, but
okay, so let me read.
Yeah.
Reverend Pyle says, thank you so much for your lecture. I noticed that a lot of the hope that your patients look forward to had to do with living, getting a new kidney, going on to a full life, growing up to make a difference, etc. As a pediatric hospice chaplain, by the time young patients get to me, the hope of living is often no longer front and center. There's a shift in the focus of hope, and sometimes it's hard to find where to place it. I'm wondering if you can speak at all to how children find hope when living beyond a few more months is almost certainly no longer a possibility. And as a spiritual caregiver, how have you helped or might help a child or young person explore a new, hopeful direction? Absolutely. So you do hear in the kids that I was talking with, hope for the future, to live, for something to be different, to be better, to accomplish something. But you also, the moments, when I ask kids to tell me a story about a hopeful time in their lives, it is almost never about an accomplishment or the future. It is almost always about a relationship. It is almost always about something like, that time I was playing video games with my friends and we were all so happy and we were giggling and I just felt peace and joy. Or every night my family joins hands around the dinner table and says a prayer. That's the most hopeful time of my day. So I would say the dominant tradition in Christianity is frames hope as chronological. Eschatology, right? It'll come someday. Someday it'll come. Everything will be better someday. There is a subjugated tradition of topological hope, place-based hope, relationship-based hope. The question isn't, when will God's realm come? It is, where and with whom do I experience God's realm? So helping kids focus on those meaningful moments in the days or months they have left. Who do you want to talk to? Who do you want to leave a message to? What pet do you want to draw a picture of? What toy do you want to snuggle with? What place do you want to see? What food do you want to eat? Helping kids root themselves concretely in people, places, and their bodies, I think, is enormous in hopeful practices. And physical reminders that they're not alone. I cannot tell you how important it is to kids in the hospital. Well, you know, you're a hospice chaplain, but for everybody else, to have a physical reminder of a congregation or someone that is important to them as a spiritual leader is, be it a card hung on the wall, be it a stuffed animal that the congregation blessed, whatever that is, they really find those material reminders important. Those mean a lot to kids. So what makes you feel best or closest to God at this point in life? Green plants? Let's get some green plants in this room. A teddy bear? Let's get a teddy bear. Whatever that is, right? And to help them have hope that they can die surrounded by people they love and they won't be forgotten. Yeah? They will be remembered. Not just called to memory, but remembered as a part of this community. Thanks, great question. And now we have more questions. How much time do we have, Trina? None.
We've actually come to the end of our time together. So it's been a wonderful discussion. It was a great question. And I am actually going to turn this over to Dr. Deborah Mumford, our Dean, for closing remarks.
Okay, thank you so much, Dr. Bidwell, for this wonderful lecture that you've given us. It has done much. I think one is raised awareness. Many of us may not have been aware that there's so many kids out there that are living with chronic disease and how that impacts their lives and the lives of all of the people who are walking that journey with them. But then also the importance, reminding us as people of faith of the importance of hope in our lives. Sometimes, I guess, the realities of the world can rob us of hope. But listening to these stories of these kids who have hope in so many different manifestations can remind us of how important it is. But one of the most important phrases to me that you said closer to the end is, where do we experience God's realm? That is something that we should ask ourselves, because you're right. Very often we think of one day things will get better. We hear on the news all of these things that are happening in the world, and it sounds awful. But if we also spend time thinking about those places in our lives where we find joy, where we find goodness and love and hope, those places are where we experience God's realm, then maybe we can think about our lives quite differently. So thank you. You've given us a tremendous gift and much to think about in the future. So we appreciate you. So can we give Dr. Bidwell a hand, please, for all of those? Yes, thank you so much.
Thank you, Dr. Munford.
For the gift.
So grateful for the gift of the invitation.
Absolutely. So one thing I just want to say, as we kind of thank Dr. Bidwell, wish you were here. We would have much more conversation with you, but I'm sure if we email you or something, you may respond to us. Thank you. So I also want to remind everybody about an upcoming lecture on November 10th at 4:00 p.m. The Urban Church and Community Development Connection is the next lecture. So it will be our annual Caldwell Lecture. So with us will be Dr. James Etta Ferguson, one of our alum, President and CEO of Molo Village Community Development Corporation, and also another alum, Stachel Bussey, founder and executive director of the Hope Bus, and another one of our alums. They will be here, and they will share with us how we can impact the local church and the community through practical and tangible ministry. And so we want to invite everyone to attend. And so you will be able to, they will be here on campus, so you'll be able to attend in person, but you can also log in via Zoom. So we hope that you all share with us. Now, let us end with a benediction, shall we? Oh God, we give you thanks for this time and this opportunity for allowing Dr. Bidwell to be with us and to remind us of the importance of hope in our lives. And as we go from this place, but never from your presence, go with us, leading, guiding, and directing all that we do, and allow us to have hope in our world. In the name of Jesus Christ, we pray. Amen.